us today. It's an important day. I want to thank the mayor for centering public health in our administration. Thank you. I want to thank Chancellor David Banks and Camille Varlak and all of our dedicated educators for helping to keep our schools safe. And I also want to thank Andrew Riggy for his work throughout the entire pandemic, advocating for our beloved venues. And a huge and special, very special thanks to Dr. Celia Quinn, my Deputy Commissioner for Disease Control and one of the public health heroes who has kept this city afloat for the past 2 years. You may not have heard Celia's name before, but she has probably saved your life. I want to first begin by recognizing the unspeakable trauma we've all experienced these last 2 years. We've lost friends, neighbors, loved ones. Nearly 40,000, each of whom has a name, a family, a story. Many of us have held a loved one's hand as they suffered because of COVID-19 or survived a bout with the virus ourselves. And many more of us have experienced severe loneliness and isolation, the effects of which will be felt and experienced for years to come. None of us would be standing here today were it not for the safe and overwhelmingly effective COVID-19 vaccines. Over 77% of New Yorkers of all ages are fully vaccinated, including 87% of all adults and hundreds of thousands of children. And millions have kept their immunity up to date by getting boosted. Each and every one of you has my heartfelt thanks. Vaccines have saved so many lives and prevented an immense amount of suffering and pain. And New York City's nation-leading vaccination policies, while sometimes controversial, were demonstrably effective. Since the beginning of our vaccination campaign in December of 2020, an estimated 48,000 deaths have been prevented. That's 48,000 New Yorkers who will celebrate their birthday this year. Over 300,000 hospitalizations have been averted, 300,000, and more than 1.9 million cases prevented as a result of New Yorkers doing right by their city and getting vaccinated. These estimates are from an updated analysis done by epidemiologists at Yale University, supported by the Health Department and the Commonwealth Fund. If any of you missed those numbers, I'll direct you to the billboard just behind you to see them. But I also want to be very clear. While this COVID-19 wave is ebbing, we can't yet say that the pandemic is ending. We still have more work to do to ensure that even more New Yorkers are vaccinated, particularly our kids, and that all are staying up to date with booster doses when it's their time. And while my tenure as your health commissioner is coming to an end soon, my teammates at the health department will continue working under my esteemed successor, Dr. Ashwin Vasan, to ensure that we keep New Yorkers safe and healthy. This is why today we're releasing a new COVID alert system to give New Yorkers a roadmap for how to mitigate their own risk today and in the future in the event that we see another surge or an increase in transmission. There are 4 color-coded levels: low, medium, high, and very high, which align with what we see in terms of community spread and impact on our healthcare system. At each level, there's clear guidance for what precautions New Yorkers should take and what actions you can expect from your city government. According to our data, we are currently at a low alert level, thankfully. The highest level, very high, or red alert, needs no explanation for those of us who survived the devastating spring 2020 first wave in New York City. Those memories are seared in our brain in perpetuity. It is a level of infection and hospitalization that we hope to never see again, but one that we must be prepared for. COVID Alert will keep New Yorkers informed about what the risk of COVID transmission looks like in our city and how you can best protect yourself and your neighbors. It will also hold us accountable by laying out proactive actions that we will take at each level. As we look to the months ahead, living with COVID, quote unquote, living with COVID cannot mean ignoring when too many continue to die of COVID. With the vaccines and now with effective free treatments that the city delivers to your doorstep within hours of your diagnosis, so much of the suffering that we have borne witness to is now unnecessary and preventable. We must do everything we can to reduce that suffering, even as we take on the many parallel pandemics worsened by COVID, from mental health to chronic diseases to structural racism. And before I hand it over to our mayor, allow me to extend my thanks to every New Yorker for the chance to serve as your health commissioner these last couple of years.
Thank you.
I believe there are jobs, there are careers, there are missions, and then there are callings. For me, getting to serve as New York City's doctor was undoubtedly a calling, and it's been the honor of a lifetime. Thank you so much. Thank you. With that, I'm going to turn it over to our amazing mayor, Eric Adams. Thank you, sir.
Thank you. Thank you. Got me tearing up. We cannot say enough about Dr. Chauncey and his team. And many of you, you benefited from his answer to call of service. And I want to thank him, his team. I want to thank the former mayor. Bill took a lot of incoming, a lot of criticism. He made some tough calls to put in place mandates. New Yorkers are not used to being told what to do. You know how we are. If you tell us to go right, we want to go left just because you told us to. But Bill had a tough time, to shut down this city, watching trucks with morgues and bodies inside, schools being closed. No matter what decision Bill made, he had an opposing view, protest marches, people who criticize him, but the numbers don't lie. When you look at the prevention, some of you are sitting here today because he was there to make those tough calls with his team. 48,000 deaths we prevented. 48,000. 303,000 hospitalizations, and 1.9 million cases. That's why I told my team, sometimes we have to look at the signs because the numbers mean nothing to far too many. But these are Bettys and Davids and Bakems and Chens and Hassims. These are real people that we prevented from dying, going to the hospital, and prevented them from getting COVID. If you were on the other end of a phone call of someone you love and they couldn't breathe and were afraid, if you stood up all nights hearing people say, I'm afraid to go to sleep because I don't think I'm going to wake up, this team saved lives. They saved lives. And I'm just so proud of the service. I'm so proud of what you did. You didn't look to put your names in lights. You just did your job, and you did it well. So, you know, we were really proud to have this transformation of power. The doctor did not have to stay. He could have, why stay in the heat of this fire? He stayed. And he partnered with Dr. Fassan and said, we're going to do this together. That's what makes New York and America great. It's the proper, peaceful transformation of power. And the information that we had is information we could use as we do in the future. And so I want to thank this team, and New Yorkers all owe them a debt of gratitude as we continue to look forward to the extraordinary work that they accomplished in saving the lives of people during a very challenging period. And so when you think about 2 years ago, we were the epicenter of the COVID virus. And 2 months ago, we became the epicenter again of the Omicron. 2 years of pain, of heartbreak, of uncertainty, of business loss, of schools closing, of just conflict inside our households. It was a tough time, but I said from the time I was elected, we are not going to allow this COVID to define us. We're going to define ourselves, because that's who we are as New Yorkers, and the crises did not control us. We leaned into our resiliency, our strength, and we pulled together and we were united, stating that we were going to defeat COVID like we defeated any other challenge that we're facing. That's why we're right here, Andrew, right here in Times Square, to tell people from Canada, from Arkansas, from New Zealand, from anywhere else, come here, but don't come in and just walk. Spend some money. And restaurants. So this community stepped up, the city stepped up, New Yorkers stepped up. They heard the call and they responded. We did the masking, we did the social distancing, we did the checks of vaccinations and booster shots. We did everything we were supposed to do. And when we reflect on this moment in time, people are going to look at the historical changes we did to save the lives of people. And we have to say thank you to the doctors and the nurses and the bodega workers in the restaurant, the dishwashers, the cooks, everyday people that did an extraordinary job. Those first responders, those who were police officers, firefighters, everyone coming together and showing why we are a professional operation with courage and service, and that is why we're here today to make this moment possible. And I would tell you time and time again, we're going to follow the numbers and we're going to follow the science. That's how we got here, and that's why we're showing the safety of New Yorkers. And we far from out of the woods. COVID is still here, but we are beating it back. We are showing them that we're going to beat it back, and New York is back. Our current positivity rate over 7-day average is only 1.8%. That is impressive to look at. And the numbers, as we stated, over 6.4 million New Yorkers are fully vaccinated, and over 17 million doses have been administered. And since the rollout of our historic vaccination program, an estimated 48,000 people, as we stated, have been prevented. That is extremely impressive. Everyday New Yorkers who are going home to their families because of that. So the key to New York City has been a success, with business compliance at 94%. Businesses have responded to it, they heard it, and they carried the mantle on the front line to make sure we can get the numbers we have. So I want to thank every business. Tough time, we went through a tough period, but we dug in deep, and we knew that we can defeat COVID in a real way, and we're going to continue to do that. And I'm glad to say that the rates are low enough that the mandatory program is no longer needed. No longer needed. Beginning Monday, March 7th, we will be suspending the requirements under Key to NYC. And so folks can come in and enjoy the restaurants, enjoy the businesses, and be a part of this great city without having to show proof of vaccination. So that means our restaurants, our businesses, and our concert venues will no longer need to require patrons to provide this proof. Now, restaurants, they still can use their discretion if they desire. It's up to them. But the overall restriction is being removed. This is about giving people the flexibility that's needed to continue to allow not only safety, but we have to get our economy back on track. It's time to open our city and get the economy back operating. And just like our economy, we're making some changes in our schools to make it easier for students and staff. Our schools have been some of the safest places. I said this over and over again. When the calls were made to close down the schools, we said no. Schools are the safest places, and we're keeping our schools safe and open, and we were able to do that. As of this week, the school's positivity rate is 0.18%. So I'm announcing today that we are lifting the indoors mask requirements for DOE schools between K through 12 starting Monday, March 7th. And that is a great initiative. And I know there's some who state that they still want their children to wear their mask. You can. We are not going to get in the way of your discretion, and we want New Yorkers to be smart, flexibility, and to be able to feel comfortable without any bullying, without any teasing. If you feel comfortable in wearing your mask, feel free to do so. I, from time to time, wear mine until we get to a point where we can wean off and get the comfortability that we want. Masks will now be an option in indoor settings and will be available for students and staff and anyone who wants to wear one, because we want to give people that comfort level. But the great part of this, you know, I know you missed it and I missed it. We want to see the faces of our children. We want to see their smiles. We want to see how happy they are. We want to see when they're feeling sad so that we can be there to comfort them. And the mask prevented us from doing so for almost 2 years. And it's happy to see those smiles again. And we will continue to keep our schools safe with our Stay Safe and Stay Open plan, including doubling down on surveillance as we have done. 85,000 students and staff are tested weekly as part of this program. Camille, thank you. You came in and just did an amazing job. All of these names that are behind the scene that keep things going. You know, when we had to do the doubling down on testing, Camille came in and organizes. We were just blown away every day on the morning calls, how impressive she was with orchestrating this activity. And we have distributed through Camille, the team of public safety, Deputy Mayor Banks, and others who have volunteered almost 20 million rapid tests and conducted over 1 million PCR surveillance tests. That's just extremely impressive in such a small period of time. We will make proper public health decisions to keep our city safe. We will pivot. If we see a reason to change any policies, we're going to be unafraid to make those adjustments and changes. COVID changes, it shifts, it modifies. We must be open to do the same and be unafraid to do so in the process. And if we see a rise in cases or hospitalizations, we're going to come back. Every morning we talk about this and we make decisions based on what's in front of us, the data and the science. That's why Dr. Chakshi mentioned in his remarks, we are launching an update alert system on COVID to keep people focused on what we're doing the way we do with any other type of crisis. And so it's imperative that we know that this battle is still on, and we're going to continue to do what's right for families and New Yorkers. For those who have not done so already, vaccination, booster shots, we cannot say it enough. It prevents hospitalizations, it prevents deaths. And we must encourage people to get vaccinated and booster shots, and you should encourage your family members to do so as well as we return back to work. We're bringing tourism back, we're bringing our economy back. It's good to be back. This is clearly an Arnold Schwarzenegger moment. We'll be back. Hold on, we're gonna turn doctors on, run the show. And then I got you something about my pinky, you know.
All right, next up, I have the privilege of introducing a son of New York City who's now serving the state. Lieutenant Governor Brian Benjamin.
Thank you. Thank you so much, Dr. Chokshi, Mr. Mayor. 2 days in a row. We're making this a habit, the city-state partnership. But it's an honor to be here with all of you here on such an auspicious occasion. I want to repeat comments that were made by Dr. Chokshi and the Mayor. Governor Kathy Hochul is very clear. We're going to follow the science. We're going to look at the numbers, follow the data, and most importantly, we're going to work collaboratively with our municipalities and counties on how we move forward together to keep everyone safe. Every city, every town is different, and we're going to continue to follow that and work on that partnership, and we will not be swayed by politics. We'll be swayed by data and what is in the best interest of keeping all New Yorkers safe. Governor Hochul a few weeks ago announced that we will stop the statewide indoor business mask or vax requirement. That was on February 10th. We then announced that we were going to lift the mask mandate in our schools, and that was only 2 days ago. And that is how to create the environment that we're moving forward on today. So I wanted to say really briefly, Governor Hochul wishes you could be here. We stand with the city 100% on the actions that it's taking, and we will continue to move forward together. But let me say, it's hard to not look at that 48,000 deaths prevented and not think about myself. I'm actually one of the 48,000 because I did contract COVID 2 weeks ago, and unfortunately, I passed it on to my wife and my 2 children. My youngest daughter is 3 months old. My second youngest is 3 years old. Neither could be vaccinated because that is not permissible. But I will say they're all recovering, mostly recovered. But me and my wife thank the state and the city and Dr. Chokshi and former Mayor de Blasio for helping to create an environment where we could be here and where I could be standing here as Lieutenant Governor on behalf of the state of New York. And let me also say, while I mention that point, we are here in Times Square. Times Square is, I think, 0.1% of the New York City landmass, but represents 15% of the economy. And so as we talk about getting through COVID, we have to talk about what are we doing to help ensure that our small businesses are able to grow and able to move forward in a way that we can feel that it helps our economy and it helps us with our taxes. The state has provided a couple of things to help. We are looking to do in our budget $1 billion to help with COVID-related expenses. And also, we're trying to legalize to-go drinks for our restaurants and bars to help them with their economy and to help the state move forward. So let me just say that it's a pleasure to be here on behalf of Governor Kathy Hochul. And I just want to remind you that there are still some settings where masks are required. So let me just say those while I'm here. All healthcare settings regulated by the Department of Health, nursing homes, adult care facilities, correctional facilities, detention centers, homeless shelters, public transportation hubs, as well as trains, planes, and airports in accordance with federal regulation. As we move forward, we're going to do the right thing. We want to open up the economy, but we still know COVID is with us. 22, and I get that right, I'm sorry if 26 peak deaths were recorded on March 2nd. So COVID is still here, but we're going to address COVID in a way that is safe and responsible and move forward. And as the mayor said, we will be flexible. If the numbers go back up, we'll change policies that way. If numbers come back down, we open up again. Common sense, pragmatic government, that's what we offer. And I'm glad to be here on behalf of the governor of the state of New York. Thank you.
Thank you so much, Lieutenant Governor. I have to take a moment just to say how grateful I am that under your and Governor Hochul's leadership, the collaboration with the mayor between our health departments in COVID response and so much more, it has benefited the people of New York City. So I'm very grateful. And next, I'm going to introduce a man who needs no introduction, especially in Times Square, Mr. Andrew Riggy, the Executive Director of the New York City Hospitality Alliance. Andrew.
Well, thank you, Doctor, Mr. Mayor, Lieutenant Governor, council members, everyone. See people on the Hospitality Alliance team, Savannah and Brittany, and also the members of the press. I mean, you've been out there with our city's restaurants and nightlife day one. You are truly essential workers. We've been out there telling the story of what our industry has gone through. You know, unfortunately, we've lost thousands of beloved businesses. We've lost jobs. We've struggled together, but we've been resilient. You know, our restaurants, our nightlife are part of the economic foundation, but also the social fabric of our city. They represent the best of all of us. And it's been trying, very trying. You know, last year, I joined former Mayor de Blasio to announce the implementation of Key to New York City. And like everything else, we always have candid conversations. We agree, we disagree, but we always agree that New York City is the best place, and we are going to fight and get through this together. And just like that, within our industry, restaurants supported this requirement. Others opposed it. It was extraordinarily challenging. But here we are today. We set up vaccination sites in all different neighborhoods. In the Lieutenant Governor's neighborhood up at Melba's, we got people vaccinated that worked in the industry, that lived in our communities. And as this pandemic evolved, as the situation evolved, we need to continue to adjust to different requirements. We need to be smart, we need to be safe, but we also need to stand together and support our restaurants, support our nightlife, because without them, New York City never recovered. We need our restaurants and our nightlife to recover, for New York City to recover, and we're all doing it together. So I want to thank you. I'm honored to be here today. Thank you, thank you, thank you. Let's bring our city back. This is a great start, and no better place to do it than the crossroads of the world. Thank you.
And with that, Mr. Mayor, I believe we're going to open it up to Q&A, so I'll turn it over to you.
No homophobes in city government.
Sounds like a plan.
Sir.
Right. On top first. Yeah. Morning, Mr. Mayor. Vaccine requirements for students. Do you think that's something that needs to be done next year? Are you planning to do that? And if not, why not? To mandate that kids get vaccines to return to school in the fall.
That's part of what's on the discussion block, and we'll discuss that with our medical professionals. And when it's time to roll that out, we'll roll it out.
A lot of people are wondering what's going to happen with Broadway shows. I know when you're lifting the key to the city, people won't have to show proof of vaccination to go to a show. But what will Broadway do? Will they require masks? Will they require vaccinations so that people feel safe when they're at the theater?
Yeah, and what we're doing, we're lifting the overall mandates that are issued by the cities, but we're allowing each industry to make their determination, entertainment industry, make their determination about their patrons that are coming in. Do they want to check for vaccines? Do they want to have mask requirements? We're recommending, if you're in a large setting, to wear a mask. But, you know, Broadway will make their determination, and we'll respect that, but we're lifting our mandates that are in place. As of now, under existing rules, he cannot.
I wonder what you might say to critics who think that vaccine requirements should be lifted for those students younger than 5, seen as transmission rate has been low among that age group.
Yeah, you know, and I was surprised when we sat down, because that came up in our morning meetings, and that's why it's so important to follow the science and listen to the doctors, because when you looked at those under 5, they were more likely to be hospitalized. And, people wanted to say, let's lift across the board, but that's not what the science was showing us. And so I know some people are concerned. I would rather people complain against me than losing my babies in the city. We got to follow the science. The science states that that age group cannot be vaccinated. And they have, among children, they're some of the highest hospitalization rates. So we have to save our children.
Mayor, can you explain how is it fair that an unvaccinated tourist from Indiana or Oklahoma, wherever, starting Monday can go to whatever restaurant they want, whereas an unvaccinated firefighter or EMS worker who lost their job doesn't get their job back. How is that fair?
Well, there was clear, this went to court, this was ruled, and how we determine fair and unfairness is in the court of law. The court of law said it's fair, and so we're going to follow the laws. It's fair. That's what the court of law said. That's the country we live in, where the court of law said this was fair, and that's what we're doing.
Just as you're rolling back key to NYC, you could reinstate the people who lost their jobs.
And here's the problem by doing so, which we wrestled with. We don't know if another variant is coming. And so when we tell New Yorkers this must be put in place to save lives, New Yorkers trusted us. And the overwhelming number of New Yorkers, city employees, did the right thing. Overwhelming number. And it sends the wrong message to those New Yorkers who stated that even if I was reluctant, I'm going to follow the rules. That is what we are doing. We can't send the wrong message that when we say something, we're going to change and vacillate. That is what was stated. People understood, particularly those who took the job with that understanding. We have people who took the job with the understanding and refused to comply. And so the information was clear. People have to comply with the rule.
Mine's off topic. Is that okay?
Good morning, everybody. In terms of the other requirements for city schools, like spacing in cafeterias and things like that, will those restrictions also be lifted?
Great question. You want to take that, Justin?
Thank you, Noel. An important question. The short answer is most of them will remain as they are. We'll continue to evaluate them one by one as the transmission rate evolves. But what we want to do is, particularly because we are lifting one of the layers, the universal mask requirement, we want to keep much of the rest of it consistent as that happens.
Scheme for determining the policies that will be in effect. There aren't hard numbers on that. So are there numerical thresholds? And if so, what are those numerical thresholds for each? And then on the lifting of the vaccine mandate, that color code, it says at orange it might come back. Why not order the return of the vaccine passports if community spread returns, considering how easily this disease spreads inside?
I'll start on that one, and of course the mayor will add as needed. So yes, there are specific thresholds and indicators that align with the CDC community levels that were released just a few days ago. We use those thresholds, the framework that the CDC has put out, and we match it up with New York City data. That allows us both to align with the federal government scheme, but also make sure that it is responsive to what is happening in New York City. We'll have additional information on the alert levels that will be released later today. And then with respect to the specific question about the vaccine pass, the key to NYC, if we do see a higher level of cases and or hospitalization, we will, as the mayor has already said, reconsider whether key to NYC or other vaccine requirements are warranted. But that's not something that will be automatically done, in part because it depends on the nature of a new variant, exactly what the velocity of increase is, what's happening in our hospitals. These are things that, as you've heard, we take the indicators into account in concert and holistically, rather than, with very specific actions following indicators.
Thank you. Well said.
Mr. Mayor, I was just wondering, with lifting these restrictions, do you plan to stop signing the emergency orders that give your administration some of this extra power over procurement and other stuff?
We're in conversation with the controller's office, Brad, the amazing relationship we have with the controller who's doing his job to audit us and make these determinations, and our job of making sure we move the city forward. And so the controller's office council is speaking on our council, and we'll be able to make a formal announcement on that in the days to come.
Mr. Mayor.
Let's right after we're gonna do you right after here, okay?
Mayor, what do you say to New Yorkers who say this will actually make them feel less likely to go to restaurants because they're worried the people at the table next to them may not be vaccinated, that they like having Key to NYC in place?
You know, there's no decision you can make in New York that you're going to get 100% of New Yorkers. 8.8 million people, 30 million opinions. We are going to open. People are going to get back in restaurants. They're going to go back to their normal lives. It's going to take time for some, but the overwhelming number of New Yorkers, like that guy behind me, New York, New York. We are all right, folks. I know people want a while stay here. We are all right. We're doing the right things. People will be back in restaurants. They are coming back out. They enjoy the city. And so those few that it's going to take a while, I understand it, you know, but the overwhelming number of New Yorkers are ready. And we are all right. And I am so happy today that these numbers show that we are all right.
Mr. Mayor,
Inside Edition. I used to love that show as a child.
oh, right. As a child? What are you saying? First of all, we do feel, as we mentioned earlier, like first responders. You know, we've been here since the beginning, so we thank you.
Thank you.
And we lost a coworker, and it means a lot. I do have another question, though, which came up. I'm sure you saw the New York Post today. The Batman comes out today, and the author writes, "The Batman made me feel miserable about living in crime-ridden New York City." So you want to open up New York City to the world. There are concerns about this crime wave. So how do you address that to out-of-towners who might be reluctant to come back to New York City?
Our Bruce Wayne in Batman wears a blue uniform with a shield on the side and a bulletproof vest. That's the Batman I depend on, the men and women that protect this city. And just as we defeated COVID, we will defeat crime. This is New York. We are winners.
Hey, Mr. Mayor, any plan to lift the private sector workplace vaccine mandate, and if not, why?
Not at this moment. It's part of our continuation of releasing as the better and better we get with these numbers. Not at this moment.
Hi, Mayor. We received the first numbers of your subway safety plan. 22 homeless individuals. We're on top. Okay.
Well, we got all the off top, we got on top.
Question about COVID-related emergency orders. Will your administration instruct city agencies to stop using COVID as an excuse to not fulfill FOILs?
They should never give you an excuse at all. They need to follow the rules. If someone is using it as an excuse, that's not acceptable. Is it time consuming? Is it taking a lot of time to do so because we're inundated with those FOILs and the manpower that's needed? I don't think they're using an excuse. There's only 24 hours in a day. We have limited staffing. And instead of responding to FOILs, if you're in H&H, you should be responding to the issues of health care. But we want to respond and be transparent, but we do have to, we're inundated with the number of FOILs requests. I don't know if it's because I came in office, we got a lot. And so they got to do it in a timely fashion, but we're not going to delay. We're going to do it as expeditious as possible. We're going to do some more topics because I got to bounce in a minute. You like that, brother? Yes.
Mr. Mayor, what's the legal guidance you're giving restaurant owners who want to keep the mandate? Will they legally be allowed to refuse service starting on Monday to someone who doesn't show a Vax card when it's no longer the citywide requirement?
Great question. We sat down with our attorneys because we thought that through also, and it covers all legal muster. They're allowed to do so. Off. Yes.
How you doing, Mr. Mayor?
How are you?
Good. I wanted to ask about the modified anti-gun unit, where that stands at the moment, where the training is, and have any units been deployed yet?
Yes. The anti-gun unit will be deployed. The police commissioner can give you a direct time. You know, that's our agency. But let's keep in mind, while we are deploying a well-trained new unit that is not going to be heavy-handed, we have a great team that's out there that's taking thousands of guns off the street. I am satisfied with those police officers, but the police commissioner is going to deploy that unit when it's properly trained, properly manned, because the worst thing could happen is that you have the wrong person in that unit executing our precision policing policy. We're going to get it right. And we're not going to do it based on the timetables of others. We're going to do it based on the timetable that we got it right.
Do you have any reaction to the latest crime statistics that came out? It seems like almost every major category is up. So anything that you have to say about that?
Yes, we got to get it right. 2 months in, we're executing our plan, and we're going to defeat crime. I'm clear on that.
Hi, Mayor. So I was wondering about this meeting you had with gay leaders. Did you agree to do anything to address their concerns about the hires in your administration?
We had a great meeting. Of anyone that was in the meeting that was there, they can tell you the outcome of it. I shared with them my history. Many of them stood up and stated, Eric, we know your history. We know that you were there for us as a cop when the gay office action lead needed you. You were there. You were there as a captain when runaway gay youth were being harassed in the 6th precinct on Christopher Street. You were there. You were there when we wanted marriage equality. You were there for gender. We were there when you put money into Stonewall House in Brooklyn. You were there when we needed money in the Brooklyn Pride Center. They said my history. Just about everyone that spoke talked about my history. The least discussed topic were the hires. They stated that how do we move forward with a mayor that has always been our friend and is an ally, and they believe in me, I believe in them, and we're going to do some good things in our follow-up meetings.
Mayor, quick question. As per lifting the restrictions about parade and festivals this summer, they're coming back to New York, for example, the Puerto Rican parade.
We have become so boring as a city. I want all my parades back, every one of them. It is time for us to enjoy our city again. All of these no's. We become a city of no's. I want to become a city of excitement. And we're going to look to reinstate every parade, every festival, every block party. People need to get outdoors and enjoy our city again. And so if you receive the no that we're not doing the parade, I need to find out why.
I get a question for Lieutenant Governor Benjamin. Can you tell us why you, in putting in expenses, travel expenses, billed to the Senate expense account when you're a state senator as well as to the state? Can you get into the weeds on that for us?
I'll be very brief. What happened was when I was in the state Senate, there were times where I had campaign activity that happened right on my way to Albany or before I went to Albany, and I paid my gas on the activity that happened beforehand. And so that was why I made those decisions. But I have reimbursed the campaign for every single gas expense. So as a practical matter, I even reimbursed every expense. So I just want to make sure that you're clear on that. The reason why I made that decision was because it was based on trailing activity. But I have, before, a couple months ago, reimbursed the campaign for everything, okay?
When you see him at the press conference, you got to say, oh, I'm glad it was him. See?
President, he's called on sanctions to Russian oligarchs. Can you tell us, how can the city help with that? Do you have plans to help with that in identifying properties the oligarchs own and helping the federal government with, for research purposes?
I'm not sure of the White House plans, but I am in alignment with the White House that this was horrific attack on a country, and we're going to reach out to the White House and ask how can we help send a strong message to Putin that this is unacceptable. What happens on the global scale played out in New York, and so we want to help the White House any way we can, and we will communicate with the White House and find out how we can help within legal boundaries.
To follow up on the question.
You got a lot of questions today. You know that?
Well, I think it's a habit of mine, and it's not going anywhere. Two questions related to crime. First of all, do you have an estimation for when the anti-gun squads will be ready to hit the streets? And secondly, how many of the homeless outreach teams of the 30 that were promised are now working?
Well, the first question, let's peel them back. The first question, they're going to hit the streets when they're ready, when they're prepared, when they're trained, and the PC is comfortable that we have the right team that's going out there. The worst thing could happen is for us to try to be expeditious to some timeline that others have created and not do the job the way I expect it to do. I've been very clear. Public safety and justice, and this team that's going to go after guns must meet my expectation of the training that I expect. And when I'm comfortable, based on the presentation from the police commissioner, I would give the thumbs up because I have to protect the city, both in public safety and justice. So when that's ready, that's when we do so. The first question you asked?
The subways, Mr. Mayor.
Yes.
There were 30 teams promised. How many are currently?
We'll get the exact numbers for you, but I'm really excited about what's happening on the subway, and I'm getting a briefing today from the team. We're moving into a real execution. You're going to see a visible change in the subway, these encampments, and all the things that we have visited and witnessed before. You're going to see the change that New Yorkers expect to look for.
Mayor, I wanted to go back on topic for a second. I know that right now mask mandates are going to be in place on public transportation, but the CDC has said that it would evaluate that on March 18th, which is just another week and a half away. I wonder if you have a feeling about whether you think it's a good idea to lift the mask mandate on public transportation, or because it's such close quarters, maybe you should keep it.
Yeah, New York is unique than any other state. And we need to always modify our responses based on the density. I think we should continue to wear the mask on the subway system. I know I will continue to do so. I use the subway a lot. So the CDC will hand down their recommendations, but I'm not at the place now where I think we need to stop wearing masks on the subways.
Mayor, at Rikers Island, are you planning to hire more corrections officers? Do you have money in the budget right now to hire more, or are you planning to keep the level exactly where it is?
We're going to go based on the recommendation of my amazing DOC commissioner that continues to impress me every day. And if he determines we need more, we're going to give more. We're going to make sure we have what we need to turn around the Department of Correction.
I have another on-topic question. Given the fact that the detection of a variant or a new coronavirus lags the spread, we're building this local color-coded system based on local spread. Doesn't it make more sense to monitor globally, like what's happening around the world? For instance, by the time we didn't realize that Omicron was here when it was already here. So doesn't it make sense to do something more preemptive?
Well, I think it makes sense for me to follow this amazing team, and their recommendation is to do our color-coded system here for locally, and they got us here. And so try and believe in what you use to get to the successful place. This is a celebratory moment. Why aren't we celebrating this? You know, why, we've been waiting for this day for so long, and we're here. And so I'm a yay sayer. I'm not a naysayer. We are winning. We are winning. So let's celebrate the win. Go out this weekend, go dine, go enjoy your family, go for a walk, stop to see me at City Hall. We are winning, folks. Let's celebrate the wonderful career of this doctor, his team, these members here. Let's celebrate New York, and let's celebrate you. You are now able to cover this close together. I remember those days 2 years ago when you wouldn't even come to a press conference sometime. We are winning, New York. We are winning because of one reason. We're made up of the best stuff on earth. We're New Yorkers. Thank you.